Escitalopram oxalate, also known as Lexapro, is a medication used to treat depression and anxiety. It helps to restore the balance of serotonin in the brain, which can improve energy levels, feelings of well-being, and decrease nervousness. The usual recommended daily dosage of escitalopram oxalate is 10 mg to 20 mg, and it is typically taken once a day in the morning or evening. It is important to take this medication at the same time each day to maintain a consistent level in your body. Always follow the instructions of your healthcare provider regarding the dosage and timing of taking this medication. Before you start taking escitalopram, make sure to read the medication guide and patient information leaflet provided by your pharmacist. If you have any questions, ask your doctor or pharmacist. Take this medication by mouth with or without food, usually once daily in the morning or evening. The dosage will be based on your medical condition, response to treatment, age, and other medications you may be taking. Be sure to tell your doctor and pharmacist about all the products you use. If you are using the liquid form of this medication, make sure to measure the dose using a special measuring device/spoon. Do not use a household spoon because you may not get the correct dose. To reduce your risk of side effects, your doctor may direct you to start taking this drug at a low dose and gradually increase your dose. Follow your doctor's instructions carefully. Do not increase your dose or use this drug more often or for longer than prescribed. Take this medication regularly to get the most benefit from it. To help you remember, take it at the same time each day. Keep taking this medication even if you feel well. Do not stop taking this medication without consulting your doctor. Some conditions may become worse when this drug is suddenly stopped. Also, you may experience symptoms such as mood swings, headache, tiredness, sleep changes, and brief feelings similar to electric shock. To prevent these symptoms while you are stopping treatment with this drug, your doctor may reduce your dose gradually. Consult your doctor or pharmacist for more details. Report any new or worsening symptoms right away. It may take 1 to 2 weeks to feel a benefit from this drug and 4 weeks to feel the full benefit of this medication. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of escitalopram oxalate include nausea, dry mouth, trouble sleeping, constipation, tiredness, drowsiness, dizziness, and increased sweating. If any of these effects persist or worsen, it's important to inform your doctor. It's essential to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the potential risks of side effects. While many people using this medication do not experience serious side effects, it's important to notify your doctor immediately if you experience any decreased interest in sex, changes in sexual ability, easy bleeding/bruising, or any very serious side effects such as black stools, fainting, fast/irregular heartbeat, or seizures. Escitalopram oxalate may increase serotonin and rarely cause a condition called serotonin syndrome/toxicity. This risk increases if you are also taking other drugs that increase serotonin, so it's important to inform your doctor or pharmacist of all the drugs you are taking. If you experience symptoms such as fast heartbeat, hallucinations, loss of coordination, severe dizziness, or unexplained fever, seek medical help right away. In rare cases, males may experience a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using the medication and seek medical help immediately. While a very serious allergic reaction to this drug is rare, it's important to seek immediate medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects not listed. If you experience any side effects, you can report them to the FDA in the US or Health Canada in Canada. When it comes to treating depression and other mental or mood disorders, antidepressant medications like escitalopram oxalate can be very helpful. They not only help in preventing suicidal thoughts and attempts but also provide other important benefits. However, it's important to note that some people, especially those younger than 25, may experience worsening depression or other mental/mood symptoms when taking antidepressants. That's why it's crucial to talk to your doctor about the potential risks and benefits of taking these medications, especially if you're younger than 25, even if you're not being treated for a mental/mood condition. If you do decide to take escitalopram oxalate, make sure to keep an eye out for any worsening depression or other psychiatric conditions, unusual behavior changes, or new/worsening anxiety, panic attacks, trouble sleeping, irritability, hostile/angry feelings, impulsive actions, severe restlessness, or very rapid speech. Be especially vigilant for these symptoms when starting a new antidepressant or when the dose is changed. And remember, always consult with your doctor if you notice any of these changes. Before taking escitalopram, it's important to tell your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that can cause allergic reactions or other problems, so it's best to discuss this with your pharmacist. Before using this medication, make sure to inform your doctor or pharmacist about your medical history, especially if you have a history of bipolar disorder, suicide attempts, liver disease, seizures, bleeding problems, low sodium in the blood, or glaucoma. Escitalopram may affect the heart rhythm, so it's important to seek medical attention if you experience symptoms such as fast or irregular heartbeat, severe dizziness, or fainting. The risk of heart rhythm issues may increase if you have certain medical conditions or are taking other drugs that can affect heart rhythm. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm issues, so it's important to talk to your doctor about using escitalopram safely, especially if you are using certain drugs or have conditions such as severe sweating, diarrhea, or vomiting. This medication may cause dizziness or drowsiness, and using alcohol or marijuana can increase these effects. It's important to avoid driving, using machinery, or doing anything that requires alertness until you can do it safely. The liquid form of this medication may contain sugar or aspartame, so if you have diabetes, phenylketonuria, or any other condition that requires you to limit or avoid these substances in your diet, it's best to consult your doctor or pharmacist about using this medication safely. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. Older adults may be more sensitive to the side effects of this drug, especially loss of coordination or bleeding, and they may also be more likely to lose too much salt, especially if they are taking water pills with this medication. Children may also be more sensitive to the side effects of this drug, especially loss of appetite and weight loss, so it's important to monitor their weight and height while taking this medication. During pregnancy, this medication should only be used when clearly needed, as it may harm an unborn baby and lead to withdrawal symptoms in newborns. It's important to discuss the benefits and risks with your doctor if you are pregnant or planning to become pregnant. This medication passes into breast milk and may have undesired effects on a nursing infant, so it's important to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions when taking escitalopram oxalate, as they can affect how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with escitalopram oxalate include other drugs that can cause bleeding/bruising, such as antiplatelet drugs and NSAIDs. Aspirin can also increase the risk of bleeding when used with this medication, so it's important to follow your doctor's instructions if you are taking low-dose aspirin for heart attack or stroke prevention. Avoid taking MAO inhibitors during treatment with escitalopram oxalate, as it may cause a serious and possibly fatal drug interaction. It's also important to be cautious if you are taking other drugs that increase serotonin, as this can increase the risk of serotonin syndrome/toxicity. Additionally, be sure to tell your doctor or pharmacist if you are taking other products that cause drowsiness, including alcohol, marijuana, antihistamines, and opioid pain relievers. It's also important to check the labels on all your medicines, as they may contain ingredients that cause drowsiness or increase the risk of bleeding. Lastly, be aware that escitalopram oxalate may interfere with certain medical/lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. It's important not to share escitalopram oxalate with others. Make sure to attend all your scheduled medical and psychiatric appointments. This will help ensure that you are receiving the proper care and monitoring while taking this medication. If you forget to take a dose of escitalopram oxalate, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one. Then, continue taking your medicine at the usual time. Don't take a double dose to make up for the missed one. When it comes to storing escitalopram oxalate, it's important to keep it at room temperature and away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposal, it's important not to flush the medication down the toilet or pour it into a drain unless instructed to do so. When the medication is expired or no longer needed, it should be properly discarded. It's best to consult with your pharmacist or local waste disposal company for guidance on proper disposal methods. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.